Thinking about your future, wondering what to do next in terms of your care needs? Well, hopefully, this next content here in this video will give you some ideas about whether or not long term care insurance is right for you. When someone enters a residential care facility, and by that I really mean someone who's living in what they call personal care or assisted living, this isn't the farthest end of the spectrum, skilled care, it can cost them between 7,000 and 11,000 per month. That is the monthly cost, not the total cost for the year. Some of the high end facilities can cost as much as $34,000 a year. Even if you're thinking about staying in your home and paying for someone to come in and take care of some of the home needs and maybe some personal care, getting dressed, doing some laundry, things like that, you're looking at $4,957 a month. Again, that's a monthly cost for that kind of care in your home. So, either way you look at it, that's a huge amount of money. And for many people, that is more than you make in your salary when you're working, let alone when you're now retired and looking for your care needs. The cost of care as we age gets so expensive that for many people, it devastates them financially. They need to sell off a property, they need to sell off a lot of their assets or transfer their assets. People think that, oh, I've got some money in a 401k, it's going to mature and I'll have that available. But once you go into a facility, it's amazing how quickly that money will disappear. So you really have to think strategically about what you want to do when you get older. And as I'll share my own personal story, who is around to take care of you? So when you turn 65 here in the United States, something called Medicare kicks in, and Medicare has parts A, B, C, and D. Medicare Part A is going to cover your hospitalizations. B is going to cover your outpatient services. And then D mainly covers medications. And although you get a fair amount of coverage with Medicare, it doesn't account for everything. You can still get personal insurance on top of Medicare and have a supplemental policy, as they call it. But again, you may be missing out on coverage for homemaker activities, as we call them, and mainly being able to stay in your home and get care with getting to appointments or doing your laundry and keeping your house clean. The challenge is too that, for my situation, for example, I'm not married, I don't have any children. So there's nobody around really that I can depend on to say, be my caregiver when I get older. For some people, it's a different situation. They have children who they may actually live with, a spouse who's very healthy and can provide some care. And so everybody's situation is different. You really have to look at your own unique circumstances to determine if this is the right approach for you. But a long term care policy basically would cover things like bathing, dressing, feeding, all of those things that would enable you to be able to stay in your home. Or you could go to assisted living and at least have that portion of your care covered. You basically, when you choose your policy, they determine, just like any life insurance policy, they determine how much coverage you're eligible for. And based on your budget today of how much you can afford to put into it, and right now, um, would dictate again to how much coverage you got when it was time for your policy to mature and become active. It's a big decision, and it's sort of kind of pardon the expression, but a crapshoot to see, will I live long enough and not have a health event that would prevent me from needing this policy? And can I afford to make an investment in this now, especially when I have so many other expenses to pay for? And that's That is the issue. Candidly, I spend $170 a month on my policy, but I do have a pre-existing condition of asthma that increased my premium quite a bit. The earlier too, though, that you can get in on a policy really helps keep the rate under control, and you'll get in before you have, often a diagnosis that might jack up the premium. Um, so there's this idea of a sweet spot in terms of long-term care. If you have, basically they say over $1 million of assets, you don't necessarily need a long-term care policy. And if you have less than $500,000 in asset, you probably can't afford that. And I'm not sure how much I agree with this. I think honestly, you need a much more than $1 million of asset for long-term care policies to no longer be worth it. And regardless, insurance, this kind of insurance policy, it's still valuable regardless of whether or not you have a ton of assets or not. If you're alive long enough, essentially, to use it, then the policy is worth it. So, is this right for you? Is this a good option for you? Well, one, you have to look at your budget and see how much money you have left over at the end of the month that you could invest in this. Like I said, I pay about $170 for my policy. They vary significantly in terms of price. I've seen as cheap as $100 and much higher. um, there is this notion that long term care is much more expensive than I just shared with you. And I think that's probably a, an unfortunate rumor that keeps a lot of people from participating. But look at your situation as well from the perspective of, look at your parents and your grandparents. How long did they live? Who took care of them when they got older? Um, is that same situation available to you now, or are you living a very different life than your parents or your grandparents? That's the key that I would look to, and look at other data points. Did you have, maybe a 23andMe genetic screen, or do you know that you're at risk for certain diseases that may, not to be morbid, but may make this policy um, not as valuable because your risk of mortality is much higher than someone else. So per year, you can look at $2,000 a year, essentially, for a policy. And that's a pretty decent policy. I mean, you're not getting the cheap end, if you will, of a policy. You're going to get some pretty good coverage at the end when you're ready to use this policy. For most people, the time when they really start to activate their policy and use it is around 75 years old. But it can vary greatly. If you are still really healthy at 75 and you're able to take care of all your care needs, then you don't need to activate it until later on when you start to become a little more limited in maybe your mobility and your ability to do things around the house. Also think in terms of, if you have a disease or you have a condition where maybe you need at home IV treatments or wound care, well, much of that should be covered by your insurance. And so you don't necessarily need your long-term care insurance for that. You can draw down from your insurance policy if they cover those services at home. Um, but even with even considering that you don't have to use it until 75, that you have other, perhaps other insurance, the reality is it takes the burden and the worry off of other people, and that in itself is really important, especially for couples as they grow old together. They worry so much about who's going to be available to care for the one that's left behind. And this is a great way to give people some peace of mind that even if one spouse passes away, there's still care available through the long term care insurance to take care of somebody going forward. So, do your math, figure out your home budget. I think it's a great value. As I mentioned, the cost of being in a facility is exorbitant. And so if we can invest today, even $2,000 a year, it sounds like a lot of money in the here and now. But if you think about what you'd be paying per year for personal care somewhere, um, it's really worth it. I think it's a good value. Anyway, if you have any questions about anything that I covered and want to talk more about long-term care insurance, just message in the comment and be sure to like the video. Thanks.